My name is Jennifer Taylor-Cousar. I'm the co-director and director of clinical research for the Adult Cystic Fibrosis program at National Jewish Health in Denver. Today we're going to be talking about the communication with patients about CFTR mutation-based therapy. In the past, all of our therapies in cystic fibrosis were directed at the signs and symptoms of cystic fibrosis. We are now able to target the basic defect. This slide is to remind you that there are classes of CFTR mutations and talk about the potential protein repair spots in these mutations. So for example, in the case of F508del, the protein is misfolded and doesn't make it to the top of the cell to function as a chloride channel. Ivacaftor and lumacaftor have now been approved to help traffic this protein to the top of the cell and improve the flow of chloride through the channel. In the case of G551D, an example of a class 3 mutation, the protein does make it to the top of the cell, but it is not open. It's like the gate is closed, and ivacaftor, the approved medication, opens that gate. In the case of class 4 mutations, such as R117H, ivacaftor improves the conductance of chloride through the channel. Now I'd like to introduce you to Sam. Sam is a 31-year-old female diagnosed with CF at the age of 3 after presenting with failure to thrive. Her genotype is F508del homozygous, and her sweat chloride is 107, typical for cystic fibrosis. Her CF has been complicated by pancreatic insufficiency, chronic sinusitis, allergic bronchopulmonary aspergillosis, CF-related diabetes, gastroesophageal reflux disease, and osteopenia. On physical exam, her temperature is a little high at 37.5, her heart rate is also a little high at 118, and her oxygen saturations are a little bit low at 93%. Her BMI is just below the recommendations for the CF Foundation at 20. On pulmonary exam, she has a wheeze with forced expiration, and she has very mild clubbing. Her lung function is moderately decreased with an FEV1 of 59%. Her chest X-ray is typical for CF with a right lower lobe infiltrate and increased plugging on the left. She is interested in learning more about CFTR modulators. Hi Sam, the nurses said you came in today to talk about some of the new CF medications that have been approved.
Yeah, I read about them on the internet and wanted to come in and hear about it.
Okay, great. What questions did you have?
Well, I actually brought them in my phone, so I'd make sure that I got everything answered.
Perfect.
So my first question is, are these medicines different from other CF medicines that I've taken in the past?
So in the past, all the medications that we use in CF were really directed at the symptoms and signs of CF. So for example, you take DNase to decrease the thickness of your mucus in your lungs. And for example, tobramycin you take to suppress the pseudomonas that's there. These new medications actually work on the basic defect in CF.
And does it work on all mutations?
Unfortunately, they don't work for all mutations. The very first medication that was approved, ivacaftor, actually was approved for a mutation called G551D. In that situation, the cystic fibrosis transmembrane conductance regulator, or CFTR, that's way too many words, which is why we just call it CFTR, actually the protein gets to the top of the cell, but it doesn't open properly. It's like the gate is closed. And so ivacaftor, the very first medicine that was approved, actually helps open that gate and lets the chloride flow.
So would ivacaftor work for my mutation?
It doesn't work for your mutations alone. So your mutations are the F508del mutations. You have 2 copies of those mutations. And with that mutation, the protein doesn't actually fold properly, so it doesn't get to the top of the cell. And even when there, it probably won't work very well to open, and so it needs 2 medications to actually fix the problem. One to get it to the top of the cell, and then one to open that gate. And the new medication that was approved is 2 medicines combined, ivacaftor and lumacaftor, so it actually does work for your mutations.
And how often would I take it?
So ideally what you do is take 2 pills every 12 hours.
So would that be with enzymes?
Yes, it's really important that you take this medication with enzymes so it's absorbed properly. But that also means you need to take it with food, particularly fatty containing foods like avocados or peanut butter or whole milk. And I can give you a list later of all the foods that will work well with it.
Okay, great. And what if I accidentally miss a dose?
So if you miss a dose, and that happens to all of us, if it's only been 6 hours, I want you to go ahead and take your dose. But if it's been more than that, I want you to wait until the next dose. Don't ever take 4 pills all at once.
Okay, okay. Are there any side effects that I should know about?
So yeah, there were side effects that were seen in the study. So that in a few patients, they actually saw elevations of the liver enzymes. And so we'd need to check your liver enzymes at baseline and then check them every 3 months for the first year after you start taking it. And then we just take them annually like we do with the rest of your labs.
Okay. What about any other tests?
So there were also some young animals tested and some young people that were tested who developed cataracts. So we do want you to get an eye exam before you start taking the medication and then annually after that.
Okay. What about any other side effects?
So most commonly what we saw in the studies and what we're seeing clinically is that people have shortness of breath and chest tightness, particularly the first 2 weeks. Most of the time that wears off and people don't have any other problems after that. There are also some people who had developed GI upset, so they had diarrhea and some stomach upset, and then some women developed irregular periods.
So if I get side effects, should I stop taking the medicine?
So it'll depend on what the side effect is and how severe it is. If it's a mild side effect, we may just try decreasing your dose for a little while and then later on putting you back on the full dose, or we may try stopping it for a little bit and then restarting it.
Let me see what other questions that I have to make sure that I get everything answered. So my husband and I have been thinking about trying to start a family. Can I try to get pregnant while I'm taking ivacaftor or lumacaftor?
That's a really good question, and a lot of our young adults are asking us this because they want to start families. Unfortunately, the FDA considers ivacaftor or lumacaftor to be a pregnancy class B. So that means that it has been tested in lab animals, and it didn't show any problems there, but it hasn't been tested in people. So really, we recommend that you not get pregnant while you're on this drug. There were some women who got pregnant and then took it in their second and third trimesters, and we didn't see any problems with the babies at this point. But really during the first trimester, we absolutely don't want you to take it.
Okay. So does this mean that if I'm taking ivacaftor or lumacaftor, I can never get pregnant?
It doesn't mean that you can never get pregnant. It just means that we have to have a long discussion about the risks to the fetus versus the risks to your health of stopping it. With ivacaftor, we saw some patients actually get sick when they stopped taking the drug, so we'd really want to balance those two issues. And so I think it would be good if you brought your husband in and you had discussions with him beforehand and we could all talk about it together.
Okay. Wow, that's a lot to think about.
Yeah.
I'll have to talk with my husband. So then will I just keep taking the birth control pills that I've been taking for the last few years?
Yeah, you can keep taking your birth control pills, but it won't be enough. So there are interactions with ivacaftor, lumacaftor, and hormonal methods of contraception. So anything that you would take by mouth or under your skin that's a hormone could be interfered with by this medication. So you need to use another method, such as an intrauterine device or a barrier method like condoms or a cervical cap.
Okay. I'll talk with my husband about that too.
Okay, good.
Okay. Let's see. So does ivacaftor, lumacaftor interact with other medicines that I take?
Well, let me just take a look here at your medication list. So it looks like there's nothing that you're on right now that'll interfere with ivacaftor, lumacaftor, but ivacaftor, lumacaftor does have several interactions with other medications, including things that are over the counter. So anytime you want to start a new medication, whether it's over the counter or being prescribed by another physician, I definitely want you to call us and make sure that there aren't interactions with your ivacaftor, lumacaftor.
Okay. That sounds like a really good plan. I'll make sure that I talk with you before I start any new medicines.
Yes, please do.
Okay. So will I have to continue taking other CF medicines if I'm taking ivacaftor or lumacaftor?
That's a good question, and everyone wants to know that actually. But during the studies, everyone stayed on all their other CF medications. And although this medication and ivacaftor alone are really game-changing medications in cystic fibrosis, they're not a cure for CF. And so unfortunately, you do have to continue to take all of your other CF medicines.
Okay. Shoot. I was hoping I'd just be able to take 2 pills twice a day and forget about everything else.
Yeah, that would be ideal, but unfortunately, we're not there yet.
Okay. How soon after starting ivacaftor or lumacaftor would I start to feel better?
Another really good question. I think there's a lot of information on the internet about patients who took ivacaftor alone and started feeling better within hours or days of taking the medicine. And your mutations are different and the medication's a little bit different, so clinically we haven't seen people feel better so quickly after starting it. Usually within a month, we'll notice that you have less cough and your energy level is better, but even if you don't feel better right away, I want you to keep taking the medicine because in the studies, they actually showed that people had less pulmonary exacerbations, so they need less oral antibiotics, less IV antibiotics. So even if you don't start feeling better right away, I want you to keep taking the medicine.
Okay. And if I'm taking ivacaftor or lumacaftor, am I allowed to participate in any clinical research trials?
Oh, another great question, because I know you participated in studies before. So there are some studies that will exclude you because you're taking ivacaftor, lumacaftor, but there are actually other studies that are specifically looking for patients on these drugs. So you'll just have to talk to the research coordinators when you find a study that you're interested in. They can let you know the criteria.
Okay. And is ivacaftor or lumacaftor covered by insurance?
Yes, it is covered by insurance. It depends on your insurance company as to what they're going to require in terms of past information, such as information about your mutations and your health status. So we'll fill all the paperwork out with you, and then we'll send those in, and it'll depend on your insurance company as to how long it'll take before your drug comes in.
Okay. Well, all of this sounds really good. I'd like to get started. What are the next steps?
Great. Well, I'm going to have one of the CF nurses come in and go over the paperwork with you to get you to fill it out. They'll also give you some more educational materials because we talked about a lot of stuff today, and that'll help remind you if you have any other questions. But we'll have you get your labs on the way out, and then once you get the medication, I want you to call the clinic and then set an appointment for a month. And so we'll have you come in and just check to see how things are going. And then a couple months after that, we'll check your liver function again.
Okay. Thank you so much for taking the time to answer all of my questions.
Absolutely. Just call us again if you have any questions after you leave.
Okay, I'll see you in a month.
Okay, sounds good. In summary, when speaking with patients about CFTR modulators, there are a few key messages that you must get to them. The mechanism of action should be reviewed briefly. We should talk about the dosage and administration, particularly the fact that they need to be taken with enzymes. Safety considerations should be discussed. It's very important to talk about pregnancy and the fact that they should not become pregnant while on this medication, and the fact that hormonal contraception alone is insufficient. You should discuss the potential drug-drug interactions, the fact that they need to stay on their maintenance therapies, and then address any other questions or concerns. I hope this video was very informative for you. Thank you for attending.